Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare at ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to educate you and your families to feel better, function better, and live as many quality, disease-free years as possible. Hopefully everybody had a great week this past week, and thanks for staying with me as we're continuing our conversation on structural integrity. We're at show number 41. And this is, I think, week 3 or 4 of structural integrity. I'm not sure how long it's going to take me to get through this one. But we started off with cellular design. We have then grown from cellular design, which I explained to you last week. We're like grains of sand on the beach. Trillions of cells that make up us. And we look at them individually, but we could also look at a beautiful beach as all of those grains of sand coming together to make one. And that's what we are. And this miracle design requires attention. And I shared the story last week of how, a guy will go outside and spend 2-3 hours polishing the car with 3 or 4 different types of compounds and waxes, and then turn around and eat a horrible lunch. And we seem men will take better care of their cars than they do this miracle of a creation called the human body. And the human body, which is made up of physical, nutritional, and psychological, requires the maintenance. It requires your part, along with working with your doctors and therapists and being engaged with your doctors and therapists to build relationships for the best possible outcomes to better health. So we're in structural integrity, which we started off shows about learning about the parts of a cell, how a cell functions. And last week I started to introduce that we're growing now into more of the physical matter, physical medicine, which is how we function, how we move, our musculoskeletal health, and the maintenance of our musculoskeletal health, because many people find themselves 40s, 50s, 60s in chronic pain. They find themselves in some daily or weekly having headaches, having back pain, neck pain, shoulder pain. I happen to be a sports chiropractor, and for 20 years I've seen people come in and out of my office. Primary reason is that they're in pain. And even though we practice differently at my office, natural medicine, or I should say natural health care, which uses a natural approach to taking care of people. Natural Healthcare Center was designed, I'm celebrating my 10-year anniversary this week at the center, and it was designed not just to look at the physical pain people are in. It's looking at it from a multidimensional, integrated perspective of using clinical nutrition, physical therapy, sports chiropractic, massage therapy, a host of integrated approaches to help a person feel better, function better, and live longer. Because yes, we could take the pain away, but if a person is type 2 diabetic or 100 pounds overweight or eating an inflammatory diet or dealing with chronic constipation, I could help take the low back pain, but I'm not getting to the root cause. So last week I shared with you that actual biochemicals, the things that we eat, can be producing the pain in our body. And if that's a new concept to you, that yes, what you eat can cause an inflammatory reaction to inflammatory body parts, then hopefully I opened your eyes up. If I haven't, we'll do that today. Because if you're dealing with muscular pain or joint pain or cartilaginous pain, ligamentous pain, bone pain, if you will, things that are biomechanical, musculoskeletal, then let's listen up today. Let's learn some things together, because Einstein said insanity is doing the same thing over and over again and expecting different results. And if you're dealing with a chronic condition, for goodness sake, please, let's stop doing the same things over and over again, and let's undo some of those behaviors to get out of that chronic state. Luke 1:37, for with God nothing is impossible. Nothing is impossible, which means that we have to work towards our goals, become better educated, become more literate, so that we could solve complex subject matters. One, for instance, which I'm not going to spend a lot of time today on case studies, but as someone who's board certified in what's called Cox technique, and this is a lumbar decompression technique, and also cervical, which is neck, I could tell you that the number of cases that do not require surgery, back pain cases, neck pain cases that do not require surgery. Hopefully those of you who are listening that are in some form of musculoskeletal or neuromusculoskeletal pain, I could tell you techniques that, for instance, I have learned that many great doctors and clinicians throughout our state are utilizing. Please become educated in the best modalities, the best conservative care, the best medical care for the conditions we're going to be speaking about today. But today we're not going to be speaking specifically about conditions like the show was designed to do. You're designed a certain way, so we want to look at the design of human anatomy. What is this physical being? Everybody grab your bicep right now, or grab your wrist, or touch your jawbone. This physical design that is made up of these structures that require cells to put them together, and in a cellular matrix creates the actual structure that you're feeling. Okay, so our body has an amazing ability to go from a little infant that we've all held in our arms. I got 5 of them at home. I remember holding each one of my children, and this little creature at a few days old can develop, grow, change, adapt into a grandmother or a grandfather. And along the course of that person's life, the transformations that happen from a musculoskeletal perspective is really profound. Many of you parents out there that have teenage boys, you literally see your child go to bed one day and then wake up 6 inches taller with these muscles bulging out of their shirt, shoe size going up a half a size to 1 size every 6 months sometimes. I hear parents tell me stories about the growth spurts of their children. And it's pretty amazing. Musculoskeletally, what our bodies can do. Our bodies can go through, if you think about it, morbidly obese to elite athlete status, right? So the transformation of the human body is remarkable. But a person a whole lot smarter than me, his name was Roger Sperry, he's a PhD, he won the Nobel Prize for brain research, said something pretty profound. He said, the more mechanically distorted a person is, the less energy is available for thinking, metabolism, and healing. Let's just stop on that for a second and think about that. So the more mechanically distorted a person is. So let's stop. What does mechanical distortion mean? Well, mechanical distortion is relatively a pretty simple thing. You could measure some of your mechanical distortion. For instance, can you bend forward and touch your toes without bending your knees? Can you do a full squat multiple times with your back flat, lowering your rump to the floor without picking your heels up off the ground? Can you turn your head 80 degrees, look over your shoulder? Particularly if you're backing your car out, please make sure you can turn your head 80 degrees. So mechanical distortion comes in a lot of different shapes and sizes. Basically, what the author is saying here is that with mechanical distortion, that's biomechanical distortion, our body's ability to move, the less energy, actual energy, which is created in the mitochondria of our cells, is available for thinking, metabolism, which is critical, and healing. So our healing rate, metabolism rate, and our thinking rate all decrease with mechanical distortion. So if we're talking about structural integrity, we have to talk about mechanical distortion because it's that important if we're talking about the physical being. On drproodian.com, which is my blog site, a couple of months ago, I blogged on what's called the home mirror tests. So if you'd like to go to drproodian.com, become a member of my blog, and you could see all my archived blogs. The home mirror test gave people pictures to go home, strip down in front of their mirror, shut the bathroom door. Everybody's got one of those full-length mirrors in there. Lock the doors, dim the lights if necessary. That's a joke. And basically, when you look at yourself, do these home mirror tests to get a kind of blueprint on what kind of mechanical distortion you may have. Because mechanical distortion is going to lead to common areas of muscle tension. Muscle tension that develop at the base of our skull, our temples, our upper shoulders, the trapezius muscle, which is the kind of big muscle on top of our shoulders, between the shoulder blades and the lower back. So muscle tension, follow this now, the base of the skull, the temples, the upper shoulders, between the shoulder blades and the lower back. It is why no one in 20 years, thousands and thousands and thousands of new patients, have ever walked into my office with front pain. They all walk in with back pain. The reason is that the muscles that keep us standing on 2 feet, which keep us walking erect, are at the base of our skull. They keep our head up. The top of our shoulders, they keep our shoulders up and back. Our lower back keeps us on 2 feet. So these muscles are chronically stressed out. They're beaten up over time. So that's why when somebody starts rubbing the top of your shoulders at 3 o'clock in the afternoon, it feels so good. And you kind of give them the don't stop line. So the areas of muscle tension, which is structural integrity, if we're getting chronic pain, now this is non-traumatic pain. This is, you didn't fall out of a window, you didn't have a car accident. I mean just everyday stress, muscular stress in our body. Well, it's coming from somewhere. It's coming from an imbalance. It's coming from positional, postural distortion, like I had went over the slide earlier. Mechanical distortion and us sitting too long causes these areas of muscle tension to set in. So the human spine, which is made up of 7 cervical vertebrae, that's our neck, 12 thoracic vertebrae, that's our mid-back, that's where the ribs connect, and the lumbar spine, which is 5 lumbar vertebrae, give us individual motion. If the spine was a carrot stick, we wouldn't have motion. So we have over 300 joints in our spine so that we could turn our head, we could bend forward to tie our shoelaces, we could squat down to pick up a little one. This is motion. So mechanical distortion, okay, will lead towards pain, especially because the muscles, which can produce a lot of pain, are just significantly tensed out. Well, why? Well, poor posture adds to muscle tension. So it causes muscles to work overtime. Fatigue and tension set into these guys due to the high demand. So like the muscles that work overtime, if you look at, like, for instance, the lower back muscles, they're called the erector spinae. In their job description, they're not called the bend over spinae. They weren't meant to bend over and pick up a heavy plant out in the garden. That's why you have a gluteus maximus. That's the muscle in your rump, the strongest muscle in the human body. We were meant to squat down and use our legs and our rump to power up, not our low back muscles. So if you start using the wrong muscles for an activity, those muscles have to work overtime, they break down, they become painful. Fatigue and tension set into these muscles. Now, I just gave you a very physical example of how working in the garden and not using the appropriate muscles. And I'm sure everybody out there can understand that. That's called macro trauma. Doing something to cause an abrupt, blunt trauma to an area. But let's think about sitting in our jobs too long. Right? Now, I just explained to you muscles work overtime, and you're probably saying, well, Proodian, if I sit and work at a computer all day, I'm not causing my muscles to work. Well, you are. You are because you're in a static position. That's why sitting at a computer 8 hours a day, sleeping 8 hours a day, and then going home and watching TV for the remaining hours of our day is basically a non-motion lifestyle. And when you live in a non-motion lifestyle, fatigue and tension set into this area, as does decay. And I'll get to that shortly. Because these body parts, if you don't use them, you lose them. So we want to use our body parts in the God-given design methodology, biomechanically, the way they were supposed to be used, like our low back muscles, are meant to keep us erect. They're not meant to allow us to bend over and pick up heavy objects. That's why we have quadriceps in our legs, hamstrings in our legs, and gluteus muscles in our rump. So what ends up happening is we go through this decay process. We sit behind a desk, we drive home, we're not doing anything, we sit behind the TV, we go to bed. All of this motion, all of this is non-motion. So the muscles begin to actually decay. They get smaller. Body fat begins to increase in the body, and then a body part that are called your ligaments, which are very, very strong structures that connect bone to bone. They're sitting down there saying, wait a minute, muscles, you guys are supposed to be doing this motion thing. My job is to connect bone to bone, yet as you decay, Mr. Muscle, you're asking me, the ligament, to pick up more of the burden. And this is why you see so many ligamentous injuries in an aging population, 40, 50, 60, 70 years old. When you start hearing all the noises come out of our bones, you get up in the morning, you start moving around, you hear pop, 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 pop. That's ligamentous. The ligaments that hold a joint together become a little bit weak. And when they become weak, they become a little destabilized. So in physical medicine, we want strong, powerful muscles to handle the load of what we put on it. We don't want the ligament, which is not even in the job description, to be picking up this load. So if this happens where the body relies upon ligaments for support, we create a weakened ligamentous system, which creates instability in our joints. Hopefully I haven't confused anyone out there, but that's a very important process as we talk about physical medicine and the physical structure of the human body. So now when this cascade starts to happen, which is weakened muscle, sedentary lifestyle, increased body fat, increased dependability upon our ligaments to pick up the load because the muscles are failing and we've put on body weight, this now sets up the cascade towards chronic pain. And I'll end the show there with the ligaments before we pick up nerves and disc and other structures, but that's a good stopping point as to where I wanted to bring you today. You've been listening to the By Design radio program with me, Dr. James Proodian. Thank you so much for allowing me to share this week with you. If you'd like to know more about me and my organizations, please go to Proodian Healthcare, Proodian healthcare.com. You could submit any questions. This upcoming week, do something good for your health, your wellness, for you and your families. May God bless you, and have a great week.
There we go. Part 3.
Okay.
I need to use my proper muscles. You know, it's interesting. So I'm trying to teach my kids karate,
Oh, yeah?
and I can feel it. Like, do your horse stance. Oh.
Were you're trained? I take it.
Yeah, when I was young.
Very
younger.
cool.
Yep.